We look for food allergies and sensitivities. Again, skin testing, blood testing we'll use here. Type G antibodies, type G4 antibodies. Those food sensitivities are so commonly a problem, let me tell you. If you haven't looked into that, you've got to do that. Foods that you're eating regularly, they're not causing you hives, they're not causing you asthma, they're not giving you a rash, but unknown to you, they're putting an inflammatory load on your system. Just thousands of people we've helped just going through that simple little process there. And again, this is one of the quirks of modern medicine. To my knowledge, it's still not taught in medical schools. It's not taught in continuing medical education. It's not in the journals as they come around. But if you talk to a naturopath, if you talk to a health food store operator, if you talk to someone at the co-op, they'll tell you about it because it's so common and everybody knows about it. But it's not, the mechanism hasn't been hammered out enough to include it, or the politics of the academic world are such that that's not talked about. But a very common situation. So be sure you're looking at that. Gluten intolerance, it's more than just diarrhea, maybe impacting aches and pains as well. Chemical sensitivity, this is a typically not discussed area. It's one thing to be toxic on a chemical because you had a lot of pesticide or solvent exposure. Something else to become sensitized where that little dose, like you're sitting there, Valerie, and the lady 4 rows down, may have a little perfume on, or she used dryer sheets, or she had something from the cleaners, and you're getting a migraine or sore throat or brain fog because of that. It's that little type of thing. And so we deal with chemical sensitivities.
In the elevator, because somebody had some on earlier.
It's one of those areas that's almost taboo in our culture to even bring up here. So I consider myself a radical bringing this up here today. Okay. Chronic infections can be ignored, and fungus is probably the commonest thing we see, but others, as we list there, can be significant parts of that load, that total load, that what's in your barrel thing there. Unresolved psychosocial stressors are important to get at. I had one lady, fibro-fatigue type lady, and we did stuff. She was doing better, but I just had this feeling there's something going on. And after about a year, it came out. She told me about it, didn't even react to it. It was a relationship thing that was a tremendous burden for her. And clearing that up was a big part of her getting well. Persistent toxic load, we talked about metals and chemicals and so on. All right, just breaking it down here, what do you do in management? We talked about diagnosis just now management. So we want to avoid pollution in the air, food, and water. Pollen, pet, dust, molds, pesticides, solvents, fragrances, selected foods, mycotoxins, gluten, avoid them. That's again, it gets back to that thing, if you can't fix it with a drug, it doesn't exist. But the first thing on my list of treatments, many doctors wouldn't even call treatments because it's avoidance. It works. Low toxic, no side effects, and doesn't cost you anything. Well, a lot of time it doesn't cost anything. Avoidance in your home, in your car, at the workplace. Reducing total load. Nutrition, we're breaking it down a little bit more here. The diet should be organic, whole, fresh, homemade, chemical-free, lots of variety. None of that junk food stuff there. Enzymes and gut healing may be important. We may need to control for allergies and sensitivities for the foods themselves. And one of those techniques is a rotary diversified diet. And then there are also some other techniques like neutralization and LDA we use. Supplements can be oral or intravenous, and I'll list some of those later on. Desensitization is important if there are allergies. Not everybody has allergies, but if they are, high-dose standard treatments can be helpful. That's the typical allergy shots, but sometimes they're too strong, I make note of there. There's also low-dose formats, low-dose, which can be used and will not trigger inflammation. We have to think about inhalants, foods, and chemicals. Okay. Detoxification, ways to help get the body get rid of waste. And exercise is one of those. Breathing deeply is good. Bowel cleanses. Some of you may have used herbal cleanses. There's actually colon therapists and so on that will wash out your bowels. Sometimes that can be helpful. Sauna therapies we talk about a lot because the sweating will actually get toxins, metals, and pesticides and things into the skin. You can wipe it off with a towel. Getting hot also mobilizes your toxins, and so they can go to the liver, and if you give enough nutrients there, dump it into the bile, into the bowels, and out in the toilet. Regular bowel movements are critical to this here, and we have to support liver function at times with things like milk thistle. Endocrine support is important in management of this. And as I hinted at before, there are better ways to look at laboratory data. What we call normal is not always good. Borderline sometimes is very important. We have to watch the assumptions we're making, and the commonest one is that the lab is telling us the whole story. We use the lab as a tool. We talk to our patients. We oftentimes will do a trial of therapy, come back in 2 to 3 months, say, did it work, did it not? And if it did, we keep going. If not, we get rid of it. We're trying to replace deficits, but also restore function. And the thyroid, adrenal, and reproductive hormones are the commonest. Growth hormone we look at a bit, but it's so expensive we rarely get involved with it. There are some things that may help stimulate natural growth hormone, however. Restoring quality sleep, whatever it takes, is so important. Whatever it takes. You need to heal up, and if you're a fibro person, that pain at nighttime and so on can be a major impairment there. And so we use medications, we use supplements, sometimes have to restructure the sleep study. Infection control, stress management. Stress management I see is dealing with the nuts and bolts of getting through life. I put the word deep counseling there because some people indeed will have things that require a prolonged psychological or spiritual type of counseling, and not just at a superficial level. Sometimes you got to dig really deep. Autonomic balancing is important. You've heard of massage and acupressure, neural therapy, acupuncture can be very helpful. I had someone in just this past week that was doing very, very well on acupuncture. Now back to nutritional supplements. Which and how do we do them? We use both intravenous and oral, sometimes intranasal. The IV solutions give you a sudden surge of high doses, and particularly in that patient that has a poor appetite or who's not digesting and absorbing well. You kind of come in the back door and give it directly. Vitamin C, calcium, magnesium, B vitamins, glutathione, taurine, trace minerals, and amino acids. The oral routes, some of the commonest things we use are good, high potency, low allergy multi, buffered vitamin C, lipoic acid, coenzyme Q10, lipotropic factors, oxygen, antioxidants, the hydroxy B12, oils like fish oil, magnesium malate with malic acid, L-carnitine to help mitochondrial function, glutathione, zinc, selenium, and TMG.